Good evening, and thank you for joining us here on blackdoctor.org Facebook Live. I am Ellis Dean, the Senior Project Manager. I don't know, I'm the Director of Digital Programming. I got to get my title right. Director of Digital Programming at blackdoctor.org. And I am excited to have this discussion with you all tonight. So before we get started, I want to, we always have our instructions. Just let us know where you're watching from. We like to get where people are watching from all over the country, all over the world, really. So we'd like to know where you're watching from. And also, we'd like to, if you have any questions, put those in the comment section. And so just because we really want this to be an interactive program, so we want you to ask any questions that you may have. And finally, if you know somebody that needs this information, make sure you tag them and share this program with them so they can get this valuable information. As I was getting prepared for our discussion tonight, I was thinking about our country, and thinking about how our culture has its macro culture, which is kind of that American culture that we all can connect to central tenets of American culture. And then there's all these micro cultures, like there is the Southeast and the Southerners, we have our culture, and the West, they've got a culture, and the Northeast has a culture. And then there's ethnicity. There's different ethnic groups, and each ethnic group has its culture. And so all these micro cultures that are all kind of blend into the macro. Well, there is a culture, in African-American culture, there is an illness that is specific to our culture, and that is sickle cell anemia, also known as sickle cell disease. And so what we're here tonight is, most people don't know that September is Sickle Cell Awareness Month. And what many people have heard that, especially if you're part of the Black American culture, you've probably heard of sickle cell, but don't really know what it is. And so what we're going to do tonight is we're going to talk about it. We're going to break it down. And we've got two wonderful guests with us. We're going to talk to Dr. Samira Brown, who you're very familiar with. She's a pediatrician and has treated sickle cell patients. So we're going to talk about the illness and the disease from a practical standpoint. And then we also have somebody that's not a stranger to Black doctors, Santonio Holmes. You know him from his NFL playing days. He was a Super Bowl MVP for the Pittsburgh Steelers. But more importantly, the reason why he's with us tonight is he runs a foundation called the Third and Long Foundation that is supportive of patients living with sickle cell disease. His son has sickle cell disease and is a very important cause to him. And so we're going to talk about what it means to be an advocate for people with sickle cell. So I know you didn't sign, that's a lot said. I know you didn't sign on to see my smiling face tonight. So first we're going to bring on Dr. Samira Brown. Good evening, Dr. Brown. How are you doing? You're on mute.
I'm doing good. Thank you so much for having me.
Oh, no, it's always a pleasure. Always a pleasure. So as people are joining us tonight, the first question out of the box is, what is sickle cell disease?
So, it's good to make sure that folks understand really what sickle cell disease and what it isn't. And it's one of the most common, inherited diseases worldwide. And it is what affects your red blood cells, specifically a protein called hemoglobin. And hemoglobin is responsible for carrying oxygen through the body. And normally your red blood cells are disc shaped. They're very flexible. It's easy for these red blood cells to move through your blood vessels. And that's important to make sure that you're getting oxygen where you need to. And in sickle cell disease, that sickle hemoglobin or hemoglobin S makes your red blood cells a crescent, or what we call that sickle shape. And it also makes those cells very sticky. So these cells, they don't bend well or move easily, and they can block blood flow to the rest of your body. And so when blood flow is blocked to any part of your body, it's very painful, and it can lead to serious problems and damage your organs. And this can be, strokes, problems with your vision and your eyes, infections, what we call pain crises, or these episodes of very intense pain. And it affects approximately 100,000 Americans here in the U.S. And is most prevalent, just as you just talked about, Ellis, in those who are African American. It's probably about 1 in 365 African American births are affected by sickle cell disease.
Okay, wow. That is something I did not know about. Like, you just really broke it down. So what is it? Let me ask you some rapid fire questions. Is it contagious?
It is not contagious. So it's inherited. So you get a hemoglobin gene from each one of your parents. And for all types of sickle cell disease, at least one of those abnormal genes causes the body to make hemoglobin S. So if both of your parents give you a hemoglobin S, then that is what's called hemoglobin SS disease or sickle cell anemia.
Okay. When is it typically diagnosed?
So that's a great question. So babies are actually screened here in the United States, universal in every state. There's a newborn screen that sickle cell is on. And so since about 2006, it's in all states. And so that typically is when you're going to be diagnosed if you have sickle cell disease, in part because when we know early, we can do treatments that can, help extend life and help improve the quality of life. So that newborn screen typically is going to be done after 24 hours of age, right in the nursery. It's a little stick of the heel for babies. And that result is going to be sent to a state lab. And then those results are going to be sent to your pediatrician. And if there's something abnormal, typically they're going to notify the family and your pediatrician.
Right. So that sounds like what should be happening. But what I'm seeing in some of these comments is that that's not universally happening. And so what I've learned when I was doing my research is that they didn't start universal testing until 2006. So prior to that, it was just kind of hit or miss with regards to testing. And even so, the person that's responding in the comment section, that their cousin didn't get diagnosed until they were 30. So they were born prior to that 2006 date, which meant it was hit or miss with regards to testing. So I'm glad it's been, but it's good to know earlier, because what you're saying is the earlier you're able to be diagnosed, the better your outcomes are with regards to this particular disease.
Yes, absolutely. And really, just to help clarify too, the first state that started screening with newborn screens was New York, and that was back in about 1975.
Okay.
And then the other states finally got in. And so the last of the 50 states was in 2006, but it should be universal screening. And that definitely is a result that every single baby should have within the first month of life. We should know if they have sickle cell disease, in part because it's absolutely imperative to make sure that all those babies who have sickle cell disease, that one, you confirm the diagnosis, that they are referred to a specialist called a hematologist, a specialist in sickle cell disease, and they get started on therapy to prevent bacterial infections, which these patients are more at risk for. So they need to get started on penicillin before 6 to 8 weeks of life.
Oh, wow. Okay. So there's a quick question. Is it true that sickle cell makes bodies resistant to malaria?
So the sickling shape sometimes can give you an advantage in terms of malaria being able to infect you. So there is some, advantage to that. Certainly if you live in an area where it's more endemic, and about 3/4 of the world who has sickle cell disease is in sub-Saharan Africa, where they certainly do have malaria very commonly.
Okay. So what is it as a pediatrician? Somebody comes to your office and says, my child has sickle cell disease. What is your response, and what is that treatment like for that particular patient starting out through the beginning of their life?
Yeah. So, one of the first things is going to be to make sure that we confirm the diagnosis and we see what their level of anemia is just starting out. And they are definitely going to come for their routine preventative visits. It's not more frequent when kids are little because they see us so frequently. They're usually seeing us every 2 to 3 months, and they're going to get screens for anemia at each one of those visits. And so the first medicine that we start to try to prevent infections is penicillin, like I mentioned. But the other important piece is to make sure that they get vaccinated against certain diseases that sickle cell patients are more susceptible to. So there's certainly bacteria like pneumococcus that they get their first vaccine right at 6 to 8 weeks again. And it's really imperative that those patients get their vaccines right on time. And so not only those visits, but we also are going to make sure that their parents understand the criteria for fever and what to do. So when sickle cell patients get fever, they need to be seen in the emergency department right away. And we cover them with antibiotics specifically for the types of bacteria that they're more susceptible to. So it's a lot of education about that. And also really talking about the importance of screening the rest of the family as well.
Mm-hmm. Wow. So you mentioned parents and family. So at this point, I'm going to bring in our other guest, our second guest, and this is Santonio Holmes, who is a parent, and is a parent that is not just a parent of somebody with sickle cell, but took it to the next level. Leveraged his celebrity. If y'all don't know who Santonio Holmes is, he is a Super Bowl MVP, played in the NFL for a number of years, and he has a child with sickle cell, and so he leveraged his celebrity. He leveraged his ability to get things done to create the Third and Long Foundation. So, Santonio, welcome to the program, first and foremost. And I wanted to say, let us know from a parent perspective what it was like when you realized that you had a child that had sickle cell.
First of all, thank you, Ellis, for having me on, the blackdoctorsorg.org. Dr. Samir, it's a pleasure just listening to you speak about sickle cell disease and how it affects so many people and the different things that they need to care for themselves and how treatments get started. For me, I was 17 years old when I had my first son and a senior in high school, and I heard so many things about sickle cell that it was a contagious disease, that you didn't want to be around people who had it, and if you saw someone with it, you kind of turned the other way. You never looked to see if that person needs help or care. So when I found out that our son was diagnosed with sickle cell, literally at birth in 2002, excuse me, I didn't know what to do as a parent. I didn't know if it was my fault that my kid had sickle cell, or who do I blame, or where did it come from?
Right.
And I just think having a lack of knowledge and education for what this disease is and how it affects so many people, and how you as a carrier or a trait carrier can affect your child and their future. It's just by having an awareness of the disease and how it's transformed and how you can transition to your kid being a full carrier of the sickle cell disease. Be aware, talk to your doctors, go get screened for yourself. And when I found out our kid had sickle cell disease, I started fighting, every doctor to understand why did this come about? What can I do to help our kid? And what are our plans for our kid's future? And seeing him struggle, for the first 6-7 years of his life, was really difficult because he couldn't explain or express the different pains that were, involved in his body, or where he was feeling them and why they were happening. And I could, just understand that as a young kid, not knowing that I was a carrier of sickle cell trait, that I had those same complications as a kid, but we couldn't rush to the hospital every time I felt dizzy, every time I had pains in my leg, or every time my back started hurting, or my forearms were getting really sore and tender. I didn't understand that I too carried this trait, but I was familiar with the symptoms and of what happens to a kid if you're outside too long, if you have if you're not eating properly, if you're not hydrating, very well. And I understood all of those complications and pains that he was experiencing. And it just made me want to fight, for every kid that is living with this disease, because as a young kid, it affects how you grow up. It affects how you interact with people. And most importantly, it affects your mindset on the stages that you carry yourself, because at some point, these kids feel that they're going to pass away soon. And because there's no treatment and no cure, that mindset has really boggled a lot of our children in society today, with how they want to go about carrying on with their lives and caring for themselves, because we have not found a cure for sickle cell disease, and it is continuing to affect so many people in our country, and even myself, and the many parents that are caring for kids with this disease.
Dr. Brown, Santonio brings up an interesting point in terms of the parents. And what are your experiences as when you're treating somebody with sickle cell? What are you experiencing? What are you hearing from the parents when they're asking you questions and they're talking to you about the challenges that they're facing raising a child with sickle cell?
Yeah, most parents are going to tell you that, just like, you, Mr. Holmes, that it impacts literally every single decision, right? What you're eating, right? How much sleep you're getting, how much hydration, what kind of activities your kids are doing, right? Are you present at those practices to make sure that we're well hydrated and that your coaches, your athletic trainers, know what they need to watch for, right? Do you have, pain medication orders at school already, right? Are there impacts in terms of their cognitive performance, right? Because we know that sometimes kids can have silent strokes that will present as academic performance declining, and making sure that the teachers are letting you know, right, when those kinds of things are happening, right? So it really depends on, the age of the child. But then a lot of times, you have very difficult, conversations about quality of life, right? And also length of life. And so treatment really needs to be directed to what the families and the patient's goals are, right? So it's our job to make sure that we're giving treatment so that our families and our patients can live as normal of a life, as possible, and that we're not dictating what that is to the families and the patients, that they're dictating really to us what they would like to see.
Yeah, it's amazing, and you bring up an interesting point. And so, we all know that African proverb that says it takes a village, right? And so, what it sounds like from what I'm hearing from you, Dr. Brown, and from you, Santonio, is that you have to create a village of wraparound services and people that are supportive of this child that has sickle cell, because you're talking about teachers at school needs to recognize what's going on in the school system. The pediatrician has to kind of sometimes be on speed dial, because if there's a pain crisis, they may need to call a hospital, call somebody to be able to get them so those services can be available to them. You've got, as a parent, you have to have your mind fully be focused at all times on making sure that everything, are they eating right? Are they hydrated? Are they sleeping? All of these different things. And so really creating a village around the child to be able to have them have as close to a normal life as possible seems very, very important. Santonio, talk to us about how difficult that process is in reality to create that village of people supporting you and your child.
First and foremost, it starts with the resources that are given to us. Once we figure out what we have to deal with as a parent, for the rest of our lives, it starts with the primary care physicians, and the information that they give us, and how connected that they continue to stay within the community that affects so many people living with sickle cell disease. I can look back at my hometown in Belgrade, Florida, and no one ever cared, should I say, to bring up how much sickle cell disease has affected this Black community. We are a predominant, Black community in Belgrade, and no one still to this day talks about the importance of sickle cell as a whole in the community, to where the programs are there for those kids that are living with this disease, for the parents that have to care for these kids with this disease, so that they can have an outline or a guideline to how important their kids need to understand eating healthy, exercising regularly, and staying away from any illegal drugs that affects the impairment of the body. Um, those things are not communicated in our community enough, to where it is a staple, to where these parents and people want to live a healthy and effective life.
Right.
The more we stay connected with our physicians in building that community and that population, to where everyone is cared for 365 days, and not just the awareness of sickle cell month, such as September, or just the day that we celebrate on June 19th. It goes beyond how many days that needs to be support and hours that need to be put into creating a better program and a system for our people in our community. The advocates that live in these communities need to be supported more by the government and by the health department in every community, in every city, in every state in the United States, and even across the globe.
Dr. Brown, it brings an important point, because sickle cell being primarily in our country a disease affecting African Americans, and so we know that there are cities and areas like one of our commenters here tonight is in DC. That's a predominantly an African American city, and so the likelihood of having services available is higher there. You were in Boston and worked in the city of Boston. Where there was a high concentration of African Americans, so services, people that had experiences. But there are Black people that are living in areas where there's not a lot of African Americans, and there may not be a lot of physicians, especially Black physicians, that have experience working with patients with sickle cell, or even understand it at the level that you did it, that you explained earlier in this programming. So talk to us about some of the training that happens, and how can we get more doctors, more especially pediatricians, the people that are first coming in contact with sickle cell patients. How do we get them better training so they're better equipped to be able to treat patients living with sickle cell disease?
Yeah, it's really important. As physicians, we are what we call students of medicine, right? There isn't a time where I know all of medicine. I am going to be a constant, lifelong, learner, just like sickle cell anemia is a lifelong disease, right? So all physicians really need to take it upon themselves to make sure that they're staying up to date with treatments and, studies that are happening, and making sure that we're getting that information to our patients. And for families who are looking for pediatricians who have experience, certainly the American Hematology Association is a great way to get linked. And especially with what has happened with telemedicine, really by and large through COVID-19, we actually have a lot more access to telemed. And so you could now establish, new patients with families who have never physically been to your office through a video visit, which previous to COVID, you really had to actually come in to see them. So definitely you can find, pediatric hematologists, adult hematologists that have that experience, and at least establish a telemed, and they often are going to be able to then find you a good primary care pediatrician or internal medicine doc, family medicine doc who has more experience. And if you're shopping for a doctor, right, those are definitely the questions that you want to ask. Do you, treat sickle cell disease patients? How many do you have? How are your outcomes, right? Where would I go if I had, trouble? Do you have good access, right, to your pediatrician? So in the middle of the night, if you have a question, are you going to be able to reach them? So these are all really critical, questions that you want to make sure that you ask not only your pediatrician, but if you're an adult, your doctor as well. So, don't, feel like just because you're in an area that doesn't have a hematologist right there, that you can't have access to one, because that certainly can happen. I think in terms of, training, certainly if you practice in an area and were trained in an area that had a lot more sickle cell disease patients like I did, certainly you just see it much more in practice, right? But it still means that after you graduate, you still need to stay up to date. And what we're really working on are a lot of the barriers to treatment, right? So if you screen patients, a lot of times they say that they don't want to come in because they have to prove their level of pain with healthcare providers across the board, and that they're labeled as drug seekers, right? That we don't give them enough support, that we don't monitor them enough. We don't talk about the side effects that they might be having from treatment. And one of the number one complaints is that they don't feel that they're necessarily involved in decision making. So these are all things that we try to talk about in training with our residents, our medical students, and certainly with our colleagues. And in terms of residents and nurses, we really try to screen for folks who are unprofessional or accusing, trying to say that sickle cell disease patients are inflating their pain versus believing, the patient next door who has cancer, right?
Right.
So we really have a lot of work to do. And also making sure that families feel empowered to advocate for their kids when they're saying that they're in pain.
Well, that's the word of the day, right? Santonio, talk about being an advocate, right? And so, how do you advocate for, especially when that child is now transitioning to becoming an adult and can no longer see a pediatrician? How do we advocate for them to find them a suitable physician? How do we advocate for them in the healthcare community to where they don't run into those obstacles? So when they do have a pain crisis and present to the emergency room, they get that roadblock, that stone wall. To how do we better advocate for patients living with sickle cell disease so they don't run into those challenges, especially as they transition into becoming an adult?
As parents, we need to collectively understand what it is that we're fighting for our kids, because the doctors have a lot of learning to do, to study the different types of medicines that are to be able to provide for each individual. But for our parents, it's understanding the list of information that you give to the physicians so that they could put together the right type of treatment plan or the right type of care plan for each individual living in that specific community. I think the more information that we give to our PCs, it allows opportunities for them to create, ways that we're more supported and we're listened, we're being heard, more sought after, other than people thinking that we're seeking, drugs just to care for our bodies or just because we're in certain types of pain. When it comes to being an advocate, we have to help get these kids better job placements. So when it comes to getting, young kids into different jobs, what are the symptoms that we need to understand that needs to be displayed to these specific jobs and the people that are hiring these kids? We need more opportunities for scholarships for our kids to go off to college. So many kids are failing in school and they're not staying on top of their task in their studies because of the different things that they have to dealing with sickle cell pain management. What are ways that us as a community are helping each of these individuals fight through these pain crises, but more importantly, give them the right treatment that they need moving forward?
So that's very important, and we've heard this term used throughout this program. And so, Dr. Brown, I want you to kind of talk about it from a practical sense, in terms of a medical sense, and then Antonio, you'll talk about it from the actual life experience, and that is pain crisis. And so, I've seen some of our comments talk about morphine and people presenting and a sickle cell patient having a pain crisis. And so, Dr. Brown, can you kind of explain what that is and what that means when we say pain crisis? And then Santonio, after she gives the practical, you give the actual in terms of what it's like as a parent experiencing having a child going through a pain crisis.
Yeah, so when we talk about pain crises, this is, the most common, complication that sickle cell anemia patients are going to have. And what happens is that because you have those abnormal hemoglobin in those red blood cells and they sickle and they get sticky, you can't get blood flow. And then when they get down to those small blood vessels, so it blocks the blood flow. It's extremely, extremely painful if you stop blood flow to any area of your body. And then it starts to do damage to your organs, right? And so it can come up out of, the blue, and it can last for hours. It can last for days, even longer, right? So it's really important that as soon as, patients are starting to feel pain, that you're able to start them on pain meds. And of course, if you have babies, right, a lot of times that's going to be fussiness, right? Like you've fed them, they don't have a dirty diaper, you've burped them, right? They're not constipated, all these kinds of things. You're going to check through your list, right? And there's nothing else. You want to really look closely, and see if their hands, their feet are swelling, right? Because that can start to happen, especially in babies, if they're not getting blood flow to their hands and their feet. It's called hand-foot syndrome, which is oftentimes the first pain crises that babies will have. And make sure that we start pain control early, that we make sure that these patients are getting hydrated, and that they're controlled. And certainly you can start with something that is an over-the-counter medicine like a Tylenol or an ibuprofen, and then you scale up to make sure that you're treating their pain correctly. And the most accurate sign of pain is the patient's report. And that really cannot be understated. That is the most accurate, indicator of pain. So we have pain scales that we use with patients, and for the little kids, it's got faces on there so they can tell you which face, they're making, right? So 0 to 10, 10 is the worst pain that you could possibly imagine, and really making sure that you're jumping on that pain and getting it under control, so that these pain crises don't last as long.
Santonio, what is it like in real life? You're on mute. Yeah.
It's very difficult for a parent to have to care for a child with a disease that this kid is unaware of how it affects him or her as an individual, and what's the livelihood or the expectancy, that they're going to live past 30 years old.
Mm.
When these things are running through your mind as a parent, you get angry at the system. You get angry at the lack of support nationally, and even the fact that there have been multiple diseases that have come about in the early 2000s and have somewhat found cures for them. But for a Black community with a population of over 100,000 plus individuals that are affected nationally with this condition, it still makes you angry that nothing is still done, because they're still giving out the same numbers that they've been giving out for the past 40 years. When is it going to change for us as parents so that we could be more in tune with ourselves and how we go about living our lives for our kids and caring for them? And to have a kid go through sickle cell crises and not be able to perform or play sports with his friends, his or her friends, to be limited to how much time he can swim in the swimming pool, to know that when the weather changes, you have to be aware of the type of clothing that they're wearing, the food that they're eating. And just like Dr. Brown said, it's the level of understanding when and how a pain crisis actually affect a kid. Because at the age of 4, Santonio had these weird moans, all day and all night, and he wouldn't talk and tell me what was going on. And it really frustrated me. It really made me scared and angry that he just sat there and was fussing all night long, all day long. And I didn't know what the care was or what the prognosis was until, it reached 2 a.m. and I just couldn't bear with the pain anymore. So as a college student, the first thing I did was drove him to the emergency room at 2 o'clock in the morning. And we stayed there all night, and so behold, my son was actually going through a pain crisis at that moment. And it really opened my eyes and understood that I need to be more aware of these symptoms and the things that are causing, these effects to his body, throughout his life. And as an advocate and as a parent, you need to be more aware, and those things need to be more attentive in your life, no matter what the situation is at any call.
Well, thank you for sharing that. And it's important to kind of get that crystallized understanding of what it's like in real life. So, Dr. Brown, I know we've mentioned like pain medication. We talked about vaccinations they need to have in order early on in life. Are there any other medications that sickle cell patients, and San Antonio, you can jump in on this as well. Are there any other medications that sickle cell patients can take on an ongoing basis that can help manage the disease on an ongoing basis instead of up down with prices and things like that?
Yeah, no, absolutely. And we want, not only physicians to know about these treatments, but we also want, families to know as well, both pediatric and adult patients who have sickle cell anemia, kind of what is out there in terms of treatments, and oftentimes what the indications are to start a treatment. Because if your primary care pediatrician or physician is not aware, then certainly you can bring this information to them and advocate for yourself or for your child. And certainly all children, like we talked about, really all the way up to 5 years old, should be on penicillin prophylaxis. And that really is strict adherence every single day, twice a day, really until they're 5 years old. There are some kids who are going to qualify to continue that penicillin prophylaxis to prevent certain bacterial diseases. And certainly if you have a child who is allergic to penicillin, there are other options. And typically we'll use a medicine that we call erythromycin. And so it's really important that, you have end on refills of your penicillin so that you don't run out. And certainly it is something that if you realize you don't have it, and doesn't matter what time, day or night, you should call your pediatrician or page them if you have them so they can send you that refill. Because that's one of the things that we find that we don't do well with, is making sure that our patients are actually getting their penicillin when they're supposed to. And that makes a big difference if kids are getting a serious bacterial infection. There's also a medicine called hydroxyurea that a lot of families with sickle cell anemia are going to be familiar with. And it's definitely one of the best medicines in terms of extending life and increasing your quality of life. So reducing the amount of pain crises that you have, reducing the amount of hospitalizations that you have. And it is typically started around 9 months of age, pretty standardly all through adolescence, but also adults with sickle cell anemia, if they've had more than 3 crises within a short period of time, we will also restart hydroxyurea to try to space those out and give them more time without these pains, and hopefully not have to come into the hospital for that. And what it does is that actually increases the size of the red blood cells. So they're not so small and sticky, and it makes them less sticky, and also helps your vasculature open up so that blood can flow easier. It's not an option for those who are pregnant and for those who are breastfeeding. So it's also good for patients to understand that restriction. There are a number of other treatments as well that have come after hydroxyurea. One is an amino acid and an antioxidant called glutamine, and that helps prevent cells from actually doing the sickling. And it can be used in conjunction with hydroxyurea, and same or similar effects in terms of your number of pain crises and your hospitalizations are certainly going to be reduced. And just like the other two, it can be given by mouth, which makes a big difference. And the other one that's newer, which is really starts at 12 years and up, which was just approved in 2019, is called voxelotor. And this prevents the red blood cells from forming the sickle shape and from binding together. So that too is a good medicine to know about. And you also may have heard about an IV medicine for 16 years and up. And this too was approved in 2019, called crizanlizumab. And I know that these are long names of drugs. And Ellis, I'm sure you can put this up in the chat, for families.
Yeah. What are you talking about? Yeah, that works.
Right? It's been shown to reduce the number of pain crises, right? And this too, it helps prevent those blood cells from really sticking to the blood vessel walls and causing that blood flow blockage, the inflammation that causes, that comes with that, the pain crises. And certainly all of these medicines can have side effects that we're going to watch for and certain monitoring that we're going to do when they're on there. But there certainly are, options in terms of medicines. And then when you talk about different cures, right, trying to get to a cure, because Mr. Holmes, you make a good point about that. Certainly, right now, sickle cell patients who do not have, a lot of what we call end organ damage, but have more severe sickle cell anemia, the one option for them is stem cell transplant, right? And so in order to get a stem cell transplant, you have to have a donor or a match who matches you very, very closely. So your best bet is a sibling. And then if you don't have a sibling, you probably have under 20% chance of actually finding a match in a bone marrow registry. So that's the other piece that we should really talk about with families, is considering signing up to be in those registries for bone marrow. And then there's also gene therapy. There are about 10 trials that are currently going on for gene therapy to try to fix that actual nucleotide error in the hemoglobin itself.
Wow. Okay. All right. Got it. One quick question, Antonio. If you have any other medicines that you want to add to this, but there was a question from our audience that says, does taking iron help at all?
So if your patient with sickle cell anemia has iron deficient anemia, a portion of it, yes. But you have to be very careful, because oftentimes one of the things that we can do to help the actual anemia that happens is to give a blood transfusion. And with that, these patients are more at risk for actual iron overload. Okay. So when we screen for anemia, we're looking at different types, because some of them can be nutritional, like iron. But if there is no iron actual deficiency, you do not want to take iron, especially in these patients, because you're going to be at risk for iron overload. But certainly things like folate, just really eating a healthy diet, making sure you've got good vitamin D, good calcium in your diet. All of those things are going to be really important, but you want to ask your doctor before you give your child something for their anemia.
Antonio?
Yes, as a parent, make a list of all the things that you actually do feed your child on a weekly, monthly basis, so that you can identify the different issues that may be affecting your kid, whether it's underlying in the types of food that they're actually eating. Staying hydrated. People talk about it all the time. I can recall moments where I have cramped, in football practices, or even waking up the next day because I may not have enough, hydration going on through my system, and my iron count gets very low. I get very dizzy at times, and I understand, what it's like to have to take iron pills, because I am an iron deficient patient. So having that issue underlying, taking those vitamins to help keep the system going, really, really helpful. And it has helped me tremendously on a day-to-day basis, even up until this point, because I'm not actively active as a professional athlete anymore. Now just living as a parent, you have to still be aware of the things that you were dealing with, previously, that they could still affect you today. So for your kid, make sure you have a list of the medicines that they're taking, the food that they're eating, and so that you can report this stuff to your physicians, and they can help you figure out where the problem lies and how we can actually easily get it, fixed.
And you can definitely request those nutritional levels from your doctor, so they can send your iron level, they can send your folate, they can send all of the, anything, in terms of a vitamin level can actually be, done in lab. So, don't be shy for actually, asking for a lab.
Absolutely. That is important. I think, Santonio, you really brought up a great point in terms of really, and I'm going to take it a step further and say you got to keep a journal, right? As a parent, you should keep a journal of everything, especially the younger your child is, the more you should journal, because they don't have all the words that they can express what's going on with them. So if you say, hey, I gave my child this, and a few hours later there was a pain crisis, you might be able to draw a kind of conclusion that this particular food or this particular whatever it could have contributed to that pain crisis happening. So those type of things, that journaling, that keep, and then that you take that in when you sit down with your doctor, when you go into the emergency room, if there is a pain crisis, having that journal so where you can kind of talk to the healthcare provider at that time, is like, this is what they've been taking, this is what they've been up to. All of that information is really going to help any healthcare provider that your child comes in contact with be more informed and better informed to be able to treat your child versus coming in and saying, hey, he's in pain, I don't know what to do. And so the more informed, and I think that's really, so Santonio, talk to us about what the goal of the Third and Long Foundation is in terms of helping create advocates, not only in parents of sickle cell children, but also in people that don't have sickle cell at all, just creating more advocates in general.
Absolutely. So the Third and Long Foundation, we created so that we could raise awareness for sickle cell community. There are so many different advocacy groups out there that support sickle cell disease. And the goal for the Third and Long Foundation was to be the missing piece that is helping those advocate programs and the hospitals build a relationship for the things that are not transparent enough to our communities. So I do a lot of behind the scenes work where I'm actually trying to find ways that we could be better advocates in our community through the programs that are already set up for every individual that is dealing with the sickle cell disease. Our goal is to raise as much awareness through the research that is being done by each of the physicians or the hospitals, and to be able to relate or be transparent with the information so that all of our patients that are living with sickle cell, that are friends of people with sickle cell disease, can have an open understanding for symptoms or signs or what they need to look out for when they're in the same space as an individual that is living with sickle cell disease.
Absolutely. Absolutely. Dr. Brown, are there any other organizations? I know you mentioned the American Hematology, I think you said earlier in the program. Are there any other organizations that parents can tap into to get information, to get more information? Because I know, the more information we have, the better equipped we are to be a better advocate. We are here at Black Doctor trying to be advocates. That's why we're having these type of programs. We've got another one tomorrow evening as well. So if you enjoyed tonight, if you want to learn more about this particular disease, check back with us tomorrow evening, 7 o'clock, and we're going to have another program. We're going to be really talking about blood transfusions. So there was a question in the night. We're going to answer that in depth tomorrow. And we got some actual live patients going to be on tomorrow's program. So make sure you check that out. But Dr. Brown, what else could we be doing? Are there any other organizations that parents can, or people in general that want to be advocates, can get more information from?
Yeah, there's some great organizations here in the U.S. One is the American Sickle Cell Anemia Association, and they can be found at ascaa.org. There's also the Sickle Cell Disease Association of America, which is sicklecelldisease.org. That's pretty easy in terms of those two. And if you Google either one, both of those will definitely come up. Almost every state is going to have their own sickle cell disease support network and association. So I also would, look up your own state sickle cell organization, because oftentimes they are going to have great resources in terms of finding, not only primary care, but also your subspecialists. And also I would take a look at the National Institute for Children's Health Quality. And so they also have regional teams that are working on sickle cell disease treatment and coordinating service delivery for individuals who are living with sickle cell disease. They also do a lot of the content development, the education in terms of newborn screening. So if you're someone who's really interested in advocating, in terms of folks getting that newborn screen identification, they're a great organization. And they're also working in terms of pediatricians, really working on that missed sickle cell disease clinic appointments. When they're missed, how do we make sure that we engage those families back in? And how do we make sure that we're providing enough support so those families can actually, come to the visits? And also the National Health, the Heart, Lung, and Blood Institute, that is a great resource in terms of clinical trials, whether it's about pain crises or sleep disorders associated with sickle cell disease, lung disease, those who are pregnant. So if you go to nhlbi.nih.gov, they actually have a list of the clinical trials if you would like to get in. And so you don't have to have severe disease to get into a trial. And you also don't have to necessarily have sickle cell disease. So definitely spend some time in taking a look, because the more folks we can get into these trials, oftentimes the better the treatments will be.
Antonio, let people know how they can get in contact with the Third and Long Foundation. Unmute.
Yes, you can email us at greaterthan@thirdandlongfoundation.org. And we'll take in, all of your questions and comments, and at least try to help, where we can. As an organization, our goal is to help people just find information and be able to share what they have, be aware, make others aware of the condition that you're living with and how they can be associates of you and be able to support you in any moment of crises. Just check us out at thirdandlongfoundation.org and Santonio Holmes Third and Long Foundation on Facebook.
Absolutely, absolutely. And so, as with any organization, especially a nonprofit organization, they need money. So please, your donation will go to really helping families, helping people become better advocates, helping legislation, helping education, anything that goes towards helping patients and people living with sickle cell disease. That's what the Third and Long Foundation is designed and dedicated to doing. He has really lent his celebrity. He has gone to the NFL and driven awareness there with the NFL. We know what a monster that league could be in terms of how powerful it is. And so he really has done a wonderful, wonderful job. And so I wanted to give him his flowers while he's here on air for the work he's doing for patients living with sickle cell. As we're wrapping up here, I want to remind everyone, thank Dr. Brown, thank Santonio Holmes for joining us this evening and really explaining it. I think we had some first-time viewers tonight, people that had never heard about sickle cell disease. We had one viewer said she had to look it up while the program was going on to find out what sickle cell is, and now we may have created an advocate by just her watching this program and you providing such wonderful information. Also, I want to remind everybody that tomorrow evening we have another program, and tomorrow we're going to really be focusing on the importance of donating blood. And I know we all know that the American Red Cross is a big organization about blood donation and transfusion. There it is. And so and it's very important to donate blood, and we're going to really dive into why and get into the why donation is very, very important for this particular patient population, specifically tomorrow evening. So check back with us tomorrow evening, 7 p.m. right here on Black Doctor Facebook Live. it's going to be a wonderful, wonderful program. And so thank you all for joining us. Thank you all for your questions. Thank you, Fifi, or YouTube. You have been a rock star. You have been really blowing us up. So I want to thank you, Christina. Thank you for joining us, Maria. Everybody, I know I can't get to everybody, but thank you all for sticking with us tonight and really learning about this disease and this illness, and really hope that we can stem that tide and help people live happier and longer lives. So thank you all again, and we will see you tomorrow evening.
Thank you.